implants and breast documentation for the ladies, and Rhys Branman is here from Cosmetic Surgeon.
You can call me R. Branman.
R. Branman.
Yeah,
I'm in Mayo. I was like, see you, R-Truth, and you were like, that just rolls off the tongue, you know? He's pretty cool. But I tell you what, I came in today and there was a crowd of ladies, behind-the-scene ladies, and they were all looking at the implants. Yeah.
They were all fascinated by them.
Yeah. So we're going to talk about the differences, first of all, in the type of implants you can choose.
Well, what you see here is we have a silicone implant right here, and then this is a saline implant. And one of the main questions I get all the time is, what is the difference between silicone and saline? And the difference really is style. I think, number one, obviously, this is filled with silicone, and this one would be filled with a saline solution.
It's not right now.
Yeah. But if a woman is looking for a softer, more natural look, we tend to go with the silicone implant. And you can tell, if you feel that, feel how it's kind of soft, and it almost feels sort of natural kind of breast tissue. The saline implant tends to be a little stiffer and give you a little bit, we call that sort of done look. And some women want that look also. And so this gives people the option of either or. And it's really kind of a nice way of going.
As far as size, though, you could choose either one of these,
We could choose either one, and these come in many different sizes. Ones that are smaller than this, and other ones that are larger than these.
And I know you've talked before about actually having them wear one of these inside a bra with that cup size.
We do.
To give them an idea.
We do. We actually take these implants, and we actually have them wear them in a bra so they get an idea of what they feel like, the weight, as well as, you know, how they're going to look after surgery. And it really gives them a really good idea how they do.
I would think so. And what about, you mentioned the weight. What does that feel like to have that extra weight?
Usually people don't feel it as much as you'd think, because most of the time the implants sit behind the muscle and they're sort of right up against the chest wall, and you just carry the women tend to carry it very well. They don't really notice the extra weight.
And you get used to it,
you get used to it.
There is anything different. All right, let's talk about the surgery itself, because that's what worries a lot of women.
Well, the surgery is very safe. It involves making a small incision and then allowing us to, that allows us to go ahead and place the implant. Recovery time is usually within about 3 or 4 days. We're using a rapid recovery technique now, where women, I've had patients that the next day or even that day, the day of surgery, they're out shopping.
No kidding.
No kidding. Yeah, it's really pretty amazing.
They want to show off.
They want to show off.
Perhaps.
I had one patient, basically, she said the next day I was out shopping, and then she went down 3 days later down to the Sugar Bowl and was able to call in the pigs.
How about that?
That's right.
But it's just amazing that they feel well enough that soon to go out and do activities like that.
Yeah, they really do.
How long do these last forever?
They don't last forever.
Okay.
They have usually a 10 to 20 year lifespan. It just depends on the implant and depends on the patient.
Yeah, and at that point they could evaluate what they did. They may want to do the same thing. They may want to change it a little bit.
That's right. Sometimes they want to go larger. Sometimes they want to go smaller. It just depends on, you know, what their desires are.
Yeah. Do they talk about the pain actually, though, following the surgery,
you know,
and how much pain there is?
What we do is we'll put in a special little pain pump that gives them pain medication right to the area, so that helps quite a bit. And we also give them pain medication. They're a little sore for the first day, but after that, they do very well.
Let's talk about the cost of this, because a lot of women may say, yes, I'd like to do it, but how much is it?
The cost ranges anywhere from about $4,000 to $6,000, depending on the type of implant that you get.
Okay, there you go. So you can come in, and of course the consultation is, I think, really what's going to ease you know, their minds about this.
Yeah, they come in, we go over all the information, we let them try on the implants, and really it's a very easy process. The one thing is that I know we couldn't show a lot of pictures, but we have a lot of pictures on our websites of before and afters.
Right, and both types of implants
and
as well.
both types of implants as well.
And sizes, so that you can get an idea. But yeah, and if you go in for the consultation, doesn't mean you're going to do it. It just means you've got a chance to ask those questions.
That's right. That's right.
And get comfortable with the idea. Okay, we want to put up the information, of course, about Cosmetic Surgery Center. And while we do, we want to remind everybody, you guys were best of the best.
That's right.
Yeah.
Yes, we were. I know. It's very exciting.
So a lot of former patients, I guess, voted in.
That's right. And it's an honor for them to vote me in as best of the best in Central Arkansas.
Okay, so Cosmetic Surgery Center on Executive Center Drive, Suite 100, right here in Little Rock. And there's the phone number, 227-0707. If you'd like to call for any other questions or to set up a consultation or appointment, you can do that. And then you mentioned the website has all the pictures.
That's
what
right.
Is that?
www.littlerockcosmeticsurgery.com.
Okay, and see all those great pictures that can give you a really good idea of what they can do for you. Thank you, Dr.
You're welcome.
R. Branman.
R. Branman. That's right.
That's right. Thanks so much for being here, Dr. Rhys. Back in just a little bit, we're going to check on your forecast. We've had a little bit of ice.